Hello everybody, it's a pleasure to talk to you again. My name is Dr. Ernst von Schwarz. I'm a cardiologist, professor of medicine in Los Angeles. Yes, absolutely. Good morning, Javier. Thank you very much for having me on. Good morning, Arizona. As you know, according to Mark Twain, I'm an expert. An expert is someone who knows as much as you do, but is from out of town. So let's talk about the hydrochloroquine. This drug is very well known to us since many, many decades. We use it for malaria. We use it for certain connective tissue diseases like lupus or arthritis. But the drug has, of course, significant side effects.
This is Eyewitness News, now at 4.
We implanted what we call a defibrillator, which is like a pacemaker, a machine.
Tara's case is extreme, but Dr. von Schwarz says when it comes to heart disease, the signs in women are often dismissed.
They might say, well, that's anxiety or that's nothing dangerous, go on with your life. We do want to exercise. We want to train this organ, the heart, the pump in our body. That's very important. So exercise helps, of course, the contractile function, the pump function of the heart. But as important as that is also to keep our blood vessels in the body elastic. And the way to do that is by exercising. Oh, hi, Trey. Thank you for having me on.
Okay, so let's get right on into it. Is it safe to go back to the gym?
I think so. I can't wait, as I mentioned earlier. I mean, the gyms here in the LA area are opening tomorrow, and I can't wait to get back in. I think it is safe as long as we all keep certain social distancing measures intact. This is a patient with a heart attack. So we feel the pulse, we give local anesthesia, then we put a catheter into the femoral artery through the groin. Through this catheter, we insert further catheters, plastic tubes, through which we inject contrast dye into the arteries of the heart. As you can see here, to look if there's a blockage. This is into the right coronary artery, and this one shows a 99% blockage, which is the reason for the heart attack. So in order to treat that, we then insert a wire into the artery. Over the wire, we insert a balloon, and then a stent, as shown here, is inflated at the side of the blockage. And there's adequate flow, there's no more blockage, heart attack treated. Good morning, Heidi, and thanks for having me, and I completely agree with you. These are challenging times, and there's only that much we can do, but as a physician, we have a few very simple recommendations which we as parents, and I'm a parent myself, of course, should follow in order to protect our children and ourselves. And it's in medicine we use what we call the KISS technique, which stands for keep it simple, stupid. So keep it really simple.
Rhythm. Dixon says before the surgery she was tired and out of breath just walking to her car. Now she says she's ready to hit the gym. The operation was performed by cardiologist Ernst von Schwarz. The device is expected to last 15 years before requiring replacement.
Cardiac contractility modulation is a relatively new technique, mainly developed in Europe, and more than 5,000 devices have been implanted in Europe. We just did the first one in California a few weeks ago. So the idea is in patients with heart failure, meaning with a weak heart, to give the heart an extra kick, if you wish.
Dr. Ernst von Schwarz, thank you so much for taking the time to kind of explain how this is going to all affect us as we move forward. Thanks for your time.
Thank you. Thanks for having me.
Well, our next guest says there are 3 things you should do immediately if someone close to you tests positive for the coronavirus. So we welcome back cardiologist and researcher Dr. Ernst von Schwarz is with us. You know, this is something really scary, doctor, because it sends people into a panic. I can only imagine. I haven't had this situation yet, but it would be one of those that it's like, oh my goodness, what do I do next? Do I lock myself in a room? Where do you go from here?
Thanks, Kara, for having me on. Absolutely. There's a lot of fear, a lot of this knowledge out there, of course, what we should do. So first of all, if you think you have the virus, you probably do have the virus. So if you think you are sick, the first thing you have to do is stay home, quarantine yourself. The second thing is get tested. That's the only way to find out, basically. And the third thing, of course, is inform your closest contacts about the potential exposure, especially if you test positive.
Okay, so those 3 simple things. When you say stay home, quarantine yourself, how long are we looking at right now?
Well, it depends. If you are tested positive, then the recommendation is, of course, to be isolated, meaning you should stay in a room. You should use your own dishes, your own towels, ideally your own bedroom, your own bathroom, at the minimum for 10 days. Or 3 days after there's no more fever, without fever-reducing medications. That depends, of course, a little bit on the severity. If you are not sure and if you are exposed, then the recommendation is to quarantine, meaning avoid going out. You don't need to isolate that strict, but you should be quarantined for a minimum of 14 days, 2 weeks, basically.
What if one of your loved ones or someone who you've been with does just get tested, does not have the results back? Would you suggest the same sort of rules as far as also quarantine yourself until they hear about whether or not they've tested positive?
Well, it depends to whom you're asking. So basically, there is no mandate that everybody needs to be tested. On the other hand, we as physicians, we strongly recommend if you have exposure, get tested. Keep in mind, the virus is contagious before symptoms occur. So the incubation period is probably 7 to 14 days, but before someone gets sick, even 2 to 3 days before, it can spread and can infect others. And even during the illness phase, depending on the severity, for 10, sometimes 20 days, that person still can be contagious. So if you have close contact, absolutely get tested.
How easy is it to get a test?
Well, most cities and states and counties have the free testing centers, which provide usually the nasal swab, which is a PCR, which detects the virus, RNA, an antigen test basically that takes a few days to get the results. That's relatively easy. Some places offer what is called the rapid PCR test, where you get a result within 1 or 2 hours. There's actually a national shortage on that right now. And there's the antibody test, which has no sense really in the acute phase. But afterwards, if someone thought he or she had been exposed or had been sick, it makes sense to do an antibody test, a blood test, to see if the person actually was exposed and was sick and has developed antibodies.
How reliable are all of these tests?
Well, the nasal swab is very reliable. According to the data, it has a 90 to 95% reliability. The rapid test is a little lower than that. It's mentioned 80 to 85%, and the blood test is in the same range.
What about that antibody test?
Yeah, that's a blood test.
Okay.
Yeah, they're very reliable. Keep in mind that a negative test really does not always rule out the exposure. In some cases, especially if there's continuous symptoms, we recommend a repeat testing. And for us as healthcare providers, even if we tested positive and feel sick, feel healthy again, then we do require 2 repeated tests within 24 hours apart, which have to be negative, before we allow our healthcare workers going back to the hospitals or the clinics.
Now, I know I've been guilty as far as symptoms go and saying, okay, is this a symptom of coronavirus? Whenever anything little spikes out of anyone that I know, are there certain symptoms for you that are no-brainers, like immediately go in and get that test?
Well, fever is the number one thing. So you have to check your temperature at least twice a day. Breathing issues, severe cough, chest pain, confusion, loss of consciousness, these would be very severe symptoms. You've heard in the news that some people just report loss of smell or loss of taste. That can be a symptom. Actually, that symptom can last for several months, even after the disease has basically completely disappeared. So it's a variety. Nothing is, however, specific. So it's more or less the same symptoms which you might have if you contract the normal flu.
Okay, so get in, get tested, and then keep yourself quarantined there. What other great tips do you have for people who are kind of in a panic about getting this virus?
Well, I mean, social distancing is key. Wearing a mask is key. Repeated hand washing, disinfecting of surfaces which are frequently touched is absolute key. So I strongly suggest avoid the gatherings. Most of the cases we are seeing now are actually people who got the virus from family gatherings where one person was sick, maybe even without significant symptoms, and then they bring it home into their household. So stay away from the gatherings, wear masks, and keep a social distance.
There's a lot of talk about a possible Twindemk as we head into the fall and winter seasons as COVID and flu season collide. Dr. Ernst von Schwarz joining us this morning. Good to see you, doctor. Thanks for coming on. Explain Twindemk for us. What is this?
Good morning, Joe. Thanks for having me on. Well, Twindemk means we have to deal with twins, with two conditions. COVID, of course, a pandemic now since the beginning of the year. And now for the fall and winter, of course, we do expect the flu season. And the worst months, as you know, is usually October, November, December, January till February. So this entire time, we are basically facing upper respiratory tract infections, not only the flu infect, all upper respiratory tract infections by any viruses do weaken our immune system. And a weakened immune system is, of course, much more susceptible to get coronavirus infected and then get COVID-19 disease in a much more severe sense than just mild symptoms. So if our immune system is already weakened and then we get something like COVID-19, we are very scared as physicians and healthcare providers what's coming. Not only because the offices will be overrun and the emergency rooms will be overrun, but also intensive care unit beds might be short again, respirators might be short. And keep in mind that the Twindemk with both of the diseases like the flu and COVID-19 is not just a simple addition, but because of the immunosuppression, which affects not only the lung and the upper airway, but the entire body, it's a summation of effect, like accumulation. Some people said 1 + 1 is not 2, but 1 + 1 = 6 or 10.
So you can get both and make it really bad for yourself as you're trying to fight these off for your immune system. What should we do? Are flu shots as important as people are saying? Obviously, we want to get those this year.
Absolutely. I mean, of course, the masks, like we always say since many, many months, and the masks do protect us somehow against the flu and other upper respiratory tract infections too. The distancing, 6 feet, don't gather again. And absolutely, we are strong proponents of the flu shots. We know that they are not 100% protective. I think in the last season, there was 40 to 50% protection. But if you get some protection, at least against some strains, that helps as much as possible. So get your flu shot and get it early, not late in December, but basically now.
All right, Dr. Ernst von Schwarz, thank you so much for joining us, sir. Always good to talk to you. Take care.
Thank you so much.
There's a lot of confusion these days about what you should do if COVID-19 hits close to home. Someone you live with or work with tests positive. To try and give us some clarity on this, Dr. Ernst von Schwarz joining us this morning. Good morning, doctor. Thanks for being here. Should we immediately get a swab test or should we wait to develop symptoms? What's the best answer there?
Good morning, Joe. You're right, there's a lot of confusion. So some of the health authorities say not everybody needs to be tested. However, if you are exposed to someone who is positive for COVID, then yes, you should get tested. The sooner, the better. And you should quarantine, meaning stay home, stay in your own room, avoid going out except for doctor's visits or medical necessities.
Yeah, a lot of people have questions about when you should go and do these things. So, Dr. von Schwarz, tell me about taking temperatures. Should we be doing that more often?
Well, ideally, again, if you think you have been exposed, yes, you should check your temperature ideally twice a day, and you want to be a bit below basically the fever levels below 1 degrees Fahrenheit, you should look out for symptoms. The typical symptoms are respiratory symptoms, as you know, like cough, sneezing, shortness of breath. In children, however, keep in mind they can present completely different, sometimes with just abdominal pain or diarrhea. So any kind of symptoms which are different from your usual normal should alert you, and that would require possibly a COVID test.
What about avoiding contact with other people? How long should we avoid kind of being around others if we think we have it?
Yeah, there's clear guidelines for that. So if you tested positive, meaning if you have COVID or had COVID, you have to isolate for a minimum of 10 days. If you think you have it, or if you think you were exposed, you should quarantine for 2 weeks. So if you had COVID, then 10 days. However, if you have high fever after 10 days, you still have to stay home and isolate. So you have to be 3 days without fever-reducing medications in order to come out of your isolation.
Some good stuff there, and I know there's so many questions about people getting tested and all that. So when to get a COVID test, some great things there. The 3 things you should immediately know. Dr. Ernst von Schwarz, thanks for joining us again this morning. We appreciate it.
Thank you so much for having me, Joe. A pleasure.
Welcome back to Fox 11. From the president and his campaign rallies to NFL games with fans in the stands in certain cities, Americans are gathering once again in certain places. Now, while large crowds are not permitted in California, how long will it be before it is safe to go out once again? And is there anything we can do to protect ourselves if we do end up at a place with large crowds? Dr. Ernst von Schwarz joining us this morning with a few things we should all be considering before attending any events. Good morning, Doctor. What do you think about gatherings at this point, at least in the state of California?
Good morning, Joe. I think it's still dangerous. We are not there yet. Just remember how COVID started in Europe, especially in Italy, which was the most hit country at that time in February. It started in a soccer stadium, San Siro Stadium in Milano, where the city of Bergamo's team had their biggest game of their lifetime. They all went home and they all infected their entire communities. So we're very concerned. I know that, and I think you mentioned the Browns won last night. They had approximately 6,000 spectators, as far as I know, in their stadium. They actually had them sign a health certificate, if you wish, or a health promise that they stay home if they are sick, and that they wear the mask except when they drink or eat, and that they keep a social distance. So having said that, I think, of course, we all want to attend the sport events and the mass events, but I think it's only possible if you follow the CDC guidelines. And if you look at the guidelines, there's 4 risk groups, and the lowest risk, obviously, as the CDC says, is stay home and watch TV. But if you have to go, or if you want to go to attend a mass sports event, then of course, check with your health authorities first, what is the transcription, the R factor in that area, number 1. Number 2, make sure you keep the social distances measures intact, 6 feet, 1.5 meters away from each other. Number 3, wear a mask. And we even nowadays say, well, if you have, then switch the mask to an N95 respirator mask, which is, of course, usually used by us as healthcare providers, but more and more people ask me about them. If you have them or if you can afford them, get them.
Sure. There's a couple of other games this weekend that we're going to see fans in the stands. The Miami Dolphins will allow a maximum of 13,000 spectators. The Vikings and the Colts at Lucas Oil in Indianapolis, they will have some 2,500 spectators, so smaller there. And then the Dallas Cowboys, they'll have their stadium open as well, letting people in. We've also seen this in the political world, of the president holding rallies. There's a lot of people in a tight space. At the NFL, they're trying to space folks out. When you see large gatherings and they're so closely together, I mean, it can't help but spread, right?
It's just wrong. It's just wrong, especially indoors. I mean, if you have to have gatherings, keep them outdoors, keep them apart, and have them wear a mask. I think it's irresponsible to have those gatherings indoors, especially if there are also elderly people, and there might be people with underlying health conditions like heart disease, diabetes, or chronic pulmonary diseases. It's just too dangerous.
And finally, real quick, are we any closer in California to moving into a place where we may see sporting events again? I know the Pac-12 is talking about playing. There may not be fans in the stands if they play football, but we're still quite a ways out in this state, aren't we?
I think so. I mean, if you look at the numbers, within the last week, there were like 260,000 new cases in the nation, not in California, but in the nation, which is less than the week before. There was a decrease in the number. However, the death cases increased approximately 6,000 cases within the last week, and that's a 16% increase compared to the week before. So even though we see less overall COVID cases, people are still dying from it. And to answer your question, I think we are still away from mass events. We might be able to attend events with limited numbers of spectators as long as the safety measures are kept intact.
Dr. Ernst von Schwarz, some good information there. Thanks so much. There's a lot of talk about a possible twindemk as we head into the fall and winter seasons as COVID and flu season collide. Dr. Ernst von Schwarz joining us this morning. Good to see you, doctor. Thanks for coming on. Explain twindemk for us. What is this?
Good morning, Joe. Thanks for having me on. Well, twindemk means we have to deal with twins, with two conditions. COVID, of course, a pandemic now since the beginning of the year, and now for the fall and winter, of course, we do expect the flu season. And the worst months, as you know, is usually October, November, December, January till February. So this entire time, we are basically facing upper respiratory tract infections, not only the flu infect, all upper respiratory tract infections by any viruses do weaken our immune system. And a weakened immune system is, of course, much more susceptible to get coronavirus infected and then get COVID-19 disease in a much more severe sense than just mild symptoms. So if our immune system is already weakened and then we get something like COVID-19, we are very scared as physicians and healthcare providers what's coming. Not only because the offices will be overrun and the emergency rooms will be overrun, but also intensive care unit beds might be short again, respirators might be short. And keep in mind that the twindemk with both of the diseases like the flu and COVID-19 is not just a simple addition, but because of the immunosuppression, which affects not only the lung and the upper airway, but the entire body, it's a summation of effect, like accumulation. Some people said 1 + 1 is not 2, but 1 + 1 = 6 or 10.
So you can get both and make it really bad for yourself as you're trying to fight these off for your immune system. What should we do? Are flu shots as important as people are saying? Obviously, we want to get those this year.
Absolutely. I mean, of course, the masks, like we always say since many, many months, and the masks do protect us somehow against the flu and other upper respiratory tract infections too. The distancing, 6 feet, don't gather again. And absolutely, we are strong proponents of the flu shots. We know that they are not 100% protective. I think in the last season, there was 40 to 50% protection. But if you get some protection, at least against some strains, that helps as much as possible. So get your flu shot and get it early, not late in December, but basically now.
All right, Dr. Ernst von Schwarz, thank you so much for joining us, sir. Always good to talk to you. Take care.
Thank you so much.
Welcome back to Afternoon Live. We're all anticipating the COVID-19 vaccines, but who gets to be vaccinated first? Here with an update is medical researcher and cardiologist. Dr. Ernst von Schwarz is back with us. Thanks for coming back, doctor. Can you hear me?
Thanks for having me.
Oh, absolutely. This is, I think, the most talked about topic, obviously, is this vaccination that we've all been waiting for months and months and months. So kind of speak to it. What are we looking forward to, and when do you feel is really going to start rolling out?
Well, as you know and heard from the news all over, there's two of the vaccine candidates who are under consideration by the FDA for what is called emergency use authorization. The first one is the BioNTech Pfizer, which was submitted for application last week, and the other one yesterday from Moderna. So the FDA is supposed to meet on December 10 to make a hopefully decision on the Pfizer product, and on December 17 on the Moderna product. So we as healthcare providers all expect and hope that the FDA will quickly turn around and might approve this emergency use authorization. And then very quickly, we should be able to get our hands on the vaccine. In fact, you might have read or heard that just of today, American Airlines, for example, equipped some of their planes with those ice-cold freezers in order to distribute the vaccine all over the country.
I'm looking at the calendar in my head, as you say, December 10th, December 17th, a quick rollout. What does quick mean, though?
Well, the FDA stated at one point that it could approve the products as quickly as between 24 and 72 hours. The FDA, of course, will talk to their advisory board, and it's not a one-man decision. It's a whole committee, basically, which will make a recommendation. But in view of the current situation with the surge of COVID infections and higher death rates, and in the last couple of months, we all expect and hope that the FDA will very quickly approve within a day or two.
And when that happens, what does that look like? Who will be the first? How many are available?
Well, you're in Oregon, for example, your Oregon Health Director released a statement just 4 days ago stating that the first 30,000 doses in your state are supposed to go to nurses and others who take care for COVID patients currently. It's a state thing, and the verdict is not clear there, but in general, the plan is right now to vaccinate healthcare providers and those in particular who deal with COVID patients first, followed by senior citizens, especially those residing in skilled nursing facility and senior citizen homes, and followed then by those which we call the high-risk groups, which is the elderly, usually patients above 65 years of age, in particular those with underlying lung and heart diseases.
So when can people like police, teachers, perhaps be looking forward to this?
That's not defined, and it's a state thing, basically. But they are considered essential workers, of course, and especially police officers and working in the prison systems, for example. They are at high risk also because they are in direct contact with a lot of people, and a lot of inmates, for example, got COVID-19. So they will be among the early group, but there's different phases. And as you know, there's some controversy about what the CDC recommends, as well as what the current government recommends, who should be vaccinated first. But we'll see. We just await the vaccine, and I will stand in line for that, and I will encourage my family to do the same thing, and otherwise we can't get rid of that virus.
Right, and then when you get the vaccination, how long until it actually works?
Well, if you look at the studies, and again, there's two things to look at. One is, of course, what has been published. And none of the large-scale data from Pfizer or Moderna have been published yet in a scientific journal. But what has been published were the smaller studies, phase 1 and early phase 2 studies about the safety. And in those studies, it showed that the immunologic response was present around 28 days after the vaccination. Keep in mind, most of the vaccine compounds require 2 vaccinations between 3 and 4 weeks apart. So within a month after the first vaccination, we can expect definitely immunologic response and probably full protection shortly thereafter.
Great information. Couldn't come soon enough. Thank you so much, Dr. Ernst.
Thank you for having me.
We'll have more information about Dr. von Schwarz on our website at KATU.com.
It is 7:42 and coronavirus cases are surging across the country. Another record number of cases confirmed just yesterday, 135,000. We're also in the middle of a transition between presidents. So what will change under a new White House leadership? To discuss, Dr. Ernst von Schwarz joining us again this morning. Dr. von Schwarz, thanks for being here. We have a transition happening, and we have this record number of cases right now. What do you expect to see that's different when Joe Biden becomes president?
Good morning, Joe. Well, I think the first thing to know is that Joe Biden repeatedly, and last year, November 9, said, trust the scientists. And that's something we as healthcare providers, of course, want to hear, because the health policy advisors and the physicians and the nurses on the forefront of treating patients with COVID-19 are the ones who have the experience. The researchers have the data. And whatever we do in order to fight this pandemic is really dependent on scientific data rather than on politics. And trusting the scientists and listen to healthcare policy advisors is key, I think, to move forward. And that's what he stated repeatedly.
And we see these number of cases that are spiking right now, 135,000 just announced yesterday. Where are we in the pandemic right now?
Probably at its worst, I think, because as you mentioned, we had the highest number. Last Friday, I think, was the first day that the US had more than 100,000 cases recorded. And keep in mind, it's the winter season is coming. So we have the Twindemk with flu pandemic coming up, lots of respiratory infections right now. The hospitals, the ERs, I just came from one of the ERs locally here, are packed with people coughing, sneezing, having fever. So the accumulation of different upper respiratory tract infections plus the risk of contracting COVID makes it much worse. Hospitals are scared with regard to their ICU bed capacities. They're filling up quickly already, and we all expect the worst to come within the next 2-3 months.
And we did get some news on a vaccine on Monday. What are your thoughts on the Pfizer vaccine and where we may be in the next few months?
I think it's to welcome, definitely. Actually, it's a combination of BioNTech, which is a German company, and Pfizer. And keep in mind, they have tested more than 43,000 people in 6 countries so far, and found a very high efficacy and effectiveness of the virus with very little side effects. So we are eagerly awaiting the release. Obviously, Pfizer has applied for an emergency use authorization by the FDA, and we all expect that we will be available to get the vaccine probably in January, maybe even before that. Biden said also that his plan is, of course, to use the vaccine initially for the people at highest risk, which are the forefront workers, healthcare workers, and the elderly and those with underlying heart and lung diseases.
Heading into the largest vaccination effort in the United States history, and it raises a lot of questions. So many people are concerned about getting a brand new vaccine. So we posted on our Facebook page asking, what do you want to know about this vaccine? So we certainly want to get you those answers. So joining us right now to answer some of your questions is Dr. Ernst von Schwarz, a medical researcher and cardiologist. And we thank you very much for taking some time with us to ease some of the concerns out there. And we start off with this question, Dr. Tammy Jamil asks, all the studies are on people over the age of 16. Will kids under the age of 16 be able to get a vaccine, doctor?
Good morning, Javier. Thanks for having me on. Well, not at the beginning. Keep in mind that the initial studies for both of the vaccine, Pfizer and the Moderna vaccine, excluded children, meaning under 16. However, just recently, as of 2 months ago, Pfizer started another study enrolling children as young as 12 years of age. in a trial to test the vaccine basically for its efficacy and safety. So at this point, we really don't have any recommendations to vaccinate children. However, this might change as soon as we get our hands on that recent study data. And within the next couple of months, of course, further studies will follow, also including younger children in vaccine trials. But at this point, children under 16 will not get vaccinated in the first or second phase of the vaccination efforts.
And we'll have to wait for the results of that study. Thank you, Doctor. We also got a lot of questions about who will be able to get the vaccine. Linda asking, will our large undocumented population here in the state of Arizona be able to get the shots, or are there paperwork requirements that will make them afraid to step up and do that?
Very good question, Linda. I mean, I'm in Los Angeles and it's the same problem here. Of course, as you know, there's a lot of undocumented people and there's a lot of fear among those who are undocumented because they think they might be tracked down if they give their information. That's probably not a good reason not to get vaccinated. On the other hand, it's up to us healthcare workers and the health politicians and the healthcare advisors to educate the population, including those who are undocumented, about the necessity and the safety of the vaccines. It's up really to the local governments to decide how to move forward here. For example, we do a lot of efforts really to try to get the word out. Our nurses do a great job and many of my colleagues do it also. We just try to inform people that the vaccine is, as far as we know, of course, safe, number one. Number two, it's needed in order to get rid of this pandemic. We need to have at least 70% of the American population vaccinated or immune.
Good point, Doctor. Well, a lot of people have been wondering if there is enough doses to go around. In fact, Dylan from Phoenix asked, with the so-called snowbirds here in Arizona right now, do they change the amount of doses Arizona will get since each state has a set number of shots based on population? And if so, will these people be able to get the vaccine here, or will they have to go back to their home states to get vaccinated?
That's a very good question. So number one is the vaccination requires 2 doses, and that's the same for the Pfizer vaccine as well as for the competitor, the Moderna vaccine. And those doses have to be given approximately 3 to 4 weeks apart. So we have to keep it within the same product, meaning you cannot or you shouldn't start with one and then switch to the other. Similarly, it should not be done across state lines, because the problem with that is really the tracking and the registration makes it very difficult from an organization point of view. So at this point, the recommendation is really if you're in Arizona and you get the first dose in Arizona, you should really get the second dose after 3 to 4 weeks, also in Arizona, not in another state.
Thank you very much for taking some time with us, Doctor, and clearing up some of the questions that our community has, and we wish you good health.
Same to you, Javier. Thank you for having me.
And there are many questions about these vaccines. We're going to try to answer a few of them right now. Dr. Ernst von Schwarz is back with us this morning. Doctor, good morning. Should you get a COVID-19 vaccine if you've already been infected by the virus?
Yes, I think so. Because at this point, Joe, we really don't know how long the immunity will last if you had COVID before. So the trials have obviously shown that the vaccine is more effective than having had an infection before. So yes.
So, and also, how long does it take to develop the immunity after you get the vaccine? There's also the 2 shots that you have to get for a couple of these.
That's right. So keep in mind that, of course, the shots create an immune response in the body. So the development of antibodies, the development of T helper cells and killer cells, these are different forms which the body has to basically do in order to be prepared if we are exposed to the virus itself. And the studies have shown that after the 2 shots within approximately a week, we will have an appropriate immune response, meaning that we are vaccinated and then immune towards a subsequent infection.
Can an employer force someone to get vaccinated in order to return to work?
I don't think so. I mean, that's regulatory issues, of course, but I think nobody per law can be really enforced or forced to get vaccinated. That's a personal decision. Of course, we encourage that at healthcare providers because we want to get rid of that horrible pandemic. And keep in mind, in order to get rid of it, I mean, the vast majority of the US population should be immunized and vaccinated.
How do we know which vaccine is going to be coming first? Is it all up to the FDA? Is that something that's kind of being decided right now? I know Pfizer's the one they're talking about.
Right now, as you know, the FDA is discussing about the Pfizer-BioNTech vaccine, which is a 2-shot messenger RNA vaccine. And then on December 17th, the second candidate, which is a Moderna vaccine, will be discussed by the FDA. So yes, Pfizer's product will be discussed and maybe even decided upon today. And if so, if the FDA will approve the emergency use authorization, then we should be able to get this vaccine within the next few days, actually, in the hospitals.
Dr. Ernst von Schwarz, a great resource for us here on Fox 11. Thanks again for joining us, answering some of our vaccine questions.
Thank you, Joe.